Dear friends, my name is Dr. Santosh Bangar. I'm a consultant old age psychiatrist looking after mental health problems of senior citizens. And most commonly the problems are dementia or memory issues, depression, delirium, to name. So I trained in UK in older people's mental health, and I've been working for more than 10 years. In Mumbai, I work at Global Hospital, Parel, Holy Family Hospital at Bandra, and my clinic at Kemps Corner. So, September is celebrated as Dementia Awareness Month all over the world, and every year World Health Organization allots a theme, and this year it is Let's Talk Dementia. So today we are going to discuss some of the problems around dementia. For example, the benefits and importance of early diagnosis. Now, what is dementia? A lot of people have different understanding and perception about dementia. So, let's get that clear. Dementia per se is a syndrome, which means it's a group of symptoms. The common symptoms are problems with the brain functions like memory issues. Most prominently, it is the short-term memory loss, which, for example, people forget what they have done a few minutes ago, or the conversation they have had, or they repeat themselves. And this causes problem with their day-to-day life. Other common groups of the brain function which are affected is thinking, judgment, organization skills, language skills, and so on. Alzheimer's disease is the commonest cause of dementia, and one of the risk factors is increasing age. So people over 65 are at higher risk, and the risk increases proportionately with increasing age. Now, Alzheimer's is not exclusively a disorder of older people. Younger people as early as third, fourth decade can also develop Alzheimer's disease. Unfortunately, this is not very common. So what are the risk factors? As I said earlier, age is one of the single most important risk factors. Secondly, diabetes, high blood pressure, lack of education, sedentary lifestyle are some of the other risk factors. Let's look at what's the scale of the problem. Now, globally, according to the recent World Health Organization report, there are more than 10 million new cases every year, which equates to every 3.2 seconds there's a diagnosed case all over the world. And in India, it is estimated that people above 60, there are more than 5.3 million people, which equals to roughly 1 in 27 people above age 60 have dementia. Now that's a huge number, and these are only going to increase because people are living longer. Okay. Coming to why it is important to diagnose dementia early. So what are the benefits? Firstly, the benefits are to the person who's suffering, because they will get a diagnosis, they will receive a diagnosis from a specialist why they have been having this problem. So sometimes it comes as a relief. Other people experience a lot of anger, extreme emotions, behavioral problem, guilt because of the diagnosis being discussed with them. And why not? It is their right to know what is wrong with them after all. Because some people or some school of thoughts believe that people suffering from Alzheimer's must not know what the problem is. So the recent evidence has said that they have a right to know what is wrong with them. Now, the important issue is about the carer, because as the disease progresses, the person suffering becomes more and more dependent on the carer, which is usually the family member, spouse, daughter, son, son-in-law, daughter-in-law. and they bore the most of the burden, what we call as carer burden or carer stress. So once we have the early diagnosis, they can plan their own life. They can make adjustments, say, to their job or their routine, their finances, etc., etc. Also, the important thing is once we have a diagnosis, there are some medications which are available, altogether 3 to 4 different types of medication, and there are a number of different trials of new molecules going every year, but unfortunately none of them have come for clinical use. So we will have to wait and watch what other different molecules are made available in the years to come. So if we give medication early, the evidence says that the longer we give the medication, the better the outcome. But this is to get the benefit in the short. As we know, the longer one survives, age is the single most risk factor. So unfortunately, there's a gradual progressive course of the disease. And mind you, nobody dies with Alzheimer's. Sorry, nobody dies due to Alzheimer's, but they die with Alzheimer's. So it's not a fatal illness on its own. I think we will stop here. These are the important issues about the benefits of early diagnosis. The second aspect of today's talk is when should people come forward to seek medical help? I think this is a very, very important issue because there are several different types of what we call as reversible dementias. For example, underactive thyroid leading to memory problems, certain vitamin deficiencies like vitamin B12, normal pressure hydrocephalus, and other mental disorders like depression or delirium can mimic Alzheimer's or other types of dementias. Now, we all know that people, as we age, people do forget things, which does not equal to dementia. Stress is an important factor, poor sleep is an important factor, where you get little bit of memory loss. And we all forget from time to time when we go to one room and don't remember why we went into the room. So people must not worry about these one-off or minor symptoms. The only thing to worry about is when they are progressing, when they are getting worse with time, when it is affecting their daily routine, then they should seek medical help. There's a very common condition called mild cognitive impairment or MCI, which is a risk factor for dementia. Most commonly, they may turn into Alzheimer's as time goes by. In this disorder, it does not affect their day-to-day functioning. So a person may have mild memory problem, but that does not affect their day-to-day life. There are other conditions which I mentioned. Depression, for example, is also common in older people, and it can cause what we call as pseudo-dementia or cognitive problems because of depression per se. And once depression is treated, this memory problems or so-called cognitive impairment improves. But mind you, depression, if it's untreated and recurrent, is a risk factor for dementia in the long run. Dear friends, I would urge you to maintain a healthy lifestyle, seek medical help. If you have any problems, quit smoking, drink alcohol in very minimal quantity, maintain a healthy lifestyle, take exercise regularly. These are the things which we can do to control dementia. If you suffer from diabetes or blood pressure, take all your medications on time and keep safe. Thank you and goodbye.